Good morning, everyone. Happy to see you in the pharmacology lecture. I am Dr. M.I.M. Shuja, and today's lecture topic is on complementary and alternative medicine. Okay. Complementary and alternative medicine. When you hear this topic, what comes to your mind is complementary. Something complement to one thing. Alternative. Something alternative to one other thing. That means when something is become alternative, it replaces certain things. Complementary means with a thing is going on, you are giving something complement to that. So complementary and alternative medicine is the term for medical products and practices that are not part of standard medical care. Now comes the question, what is standard medical care? Standard medical care, the treatment that is accepted by medical experts like medical officers, consultants, as a proper treatment for a certain type of disease, and that is widely used by healthcare professionals. Like if a patient comes with lower respiratory tract infection, if you are suspecting it is a bacterial pneumonia, you are giving antibiotics. That's the standard medical care. We call that best practice, standard of care, or standard therapy. Other than this medical treatment, what we are giving, so sometimes we may ask the patient to nebulize with water vapor. That is a complementary. Okay. The broad term complementary and alternative medicine covers a range of widely varied diagnostic and therapeutic practices like herbal and traditional medicines, homeopathic remedies, dietary supplements. Yeah. So these are few remedies. When you look at this picture, what the word comes to your mind? Ayurveda or herbal. Why the physicians or future doctors like you all need to worry about these complementary or alternative preparation? Wait, something happened, and these are the daily fun and happiness is the technical issue. All are out of our hand. So why, as a medical doctors or future doctors like you all, need to know about this complementary and alternative medicine is we are prescribing standard medicine or Western medicine, the drugs. So what will happen is there are interaction with your drug component. When we are giving too much of drugs, not a monotherapy, multi-therapy, those drugs have interaction between each other. So when you are giving a drug and the patient is taking some other Ayurvedic or herbal remedies, that might affect your efficacy of your Western drug. So as a medical doctor, you all should know very well about the Western drugs and what's the interaction with herbal thing. Okay, now it came. I hope all of you can see the screen. So we will continue. So what is integrative medicine? When the name integrative means the two practices become combined. That is, we are combining conventional medicine with the complementary and alternative medicine. So what is conventional medicine? Conventional medicine is, so listen to this definition carefully, is a system in which health professionals who hold an MBBS degree that people like you treat symptoms and diseases using drugs, radiation, or surgery. It may also called allopathic medicine or biomedicine, Western medicine, mainstream medicine, or orthodox medicine. So when we are combining the complementary and alternative medicine, with this conventional medicine that we call integrative medicine. Complementary medicine is used along with the standard medical treatment, but it is not by itself standard medicine. Like when you are treating a cancer patient with chemotherapy drug, Western drug, you might get pain. So to reduce or relieve the pain, the doctor may prescribe or use acupuncture. So this acupuncture is a complementary medicine here. So this picture shows acupuncture. This is a massage, acupuncture, and this is Tai Chi, kind of Chinese art. The coffee, herbal coffee, everything is complementary. Alternative medicine it is used instead of standard medical treatment. For example, instead of giving cancer drugs, some oncologists used to prescribe herbal treatment or special diet for that. So these are alternatives. There has been less research done on most of the type of alternative medicine. So you should know there is conventional medicine, complementary medicine, alternative medicine. All three combined together we call integrative medicine. So now we will see the type of complementary and alternative medicine. But even though people believe all these therapies or CAM is helpful, but still is debatable, and there are a lot of research need to be done to exactly say the benefit of this. We call it natural, home remedy, Eastern medicine. We are using these terms to the CAM. Under the complementary and alternative medicine, there are 5 categories. One is alternative medical systems, mind-body techniques, biologically based practices, manipulative and body-based therapies, and energy therapy. So these are the main 5 domains, like manipulative and body-based methods, like massage. Mind-body medicine, your body and mind are correlated, like meditation, hypnotherapy, mindfulness-based stress reduction, energy therapies like acupuncture, acupressure, biologically based therapies like diet supplement, and alternative medical system like homeopathy and Chinese other kind of medicine like. We'll look into mind-body therapies. So they are focusing your body and the mind in a combined manner. Like you are having a breathe in, breathe out. That is controlled by your brain. Like sit here, take a breath in, slow and steady, hold the breath as long as possible, then release gradually, slowly as possible. So like that you have to do controlling your mind without thinking about other things. Like when you are having the breath in and out, you are thinking about your girlfriend, that is horrible. Okay. You are thinking about some other problem, that is your mind is not in a quiet. Okay. You have to keep your mind quiet, so you have to stay somewhere calm and do the things. And if you want to control your mind, you can just count from 100 to 1 in a descending manner. That is meditation and hypnosis. What they do is in a state, they keep you to the sleep or they allow you to partially sleep and they control or suggest something to heal your mind. This is meditation, these are hypnotherapy, these are biofeed mechanism. Using a machine, the patient is allowed to control his mind and body. And yoga is again another ancient practice. And Tai Chi is again a kind of martial arts and imaginary. That means you focus only on the positive images in the mind, like you are helping poorly needed children and you are being with your family, your parents, like that. You are thinking positive images, but don't think about your girlfriend. Okay, then your stress will goes up. So you have to think, focus on positive images in the mind. Then creative outlets, you use art, music, dance. See, some people when they are stressed, my wife is looking because I said don't think about girlfriend, okay? So the creative outlet means when you are stressed, sometimes what people do, they go to the room, close it, then they dance. Or they listen to a music in a calm manner. So all these are try to heal your mind. If the mind is healing, automatically the body is healing. So people believe this complementary therapy will help in healing of pathology as well. Okay. So what we are studying is complementary and alternative medicine. Don't worry, I'll be teaching you the proper medicine in future. So this is yoga, this is Tai Chi, that kind of practice. These are different poses or position of the Tai Chi. It's you may see in this kind of position in Japanese or Chinese action movie, the karate, kung fu, like that. This is Tai Chi. And the second thing is biologically based practices, like you are giving vitamins, dietary supplement, and botanical plant substance like ganja. Ganja is also the lower level. It is a treatment. When it go beyond the level, it becomes addicted and causes problem. But a small amount of cannabis or ganja that used for treatment in our ancient time. Okay. Then the manipulative and body-based practices like massage, chiropractic therapy, that is used to they manipulate the joints, mainly spine and major joints. They used to manipulate it. Then reflexology, that means you are applying a kind of pressure in the hand and foot only. So they believe a certain part of the body is having a connection with this. Everything there's some connection. I will show you the picture. So if you are applying a pressure somewhere here, it will heal some major organ like heart or lung. So this is the massage, normal massage. This is your, I told, chiropractic therapy. Manipulation of the skeletal, mainly spine and joint. And this is the foot reflexology. So if you, they say the right leg, right foot, in this part is for the eye. So if you are going to apply continuous pressure for a certain time, it is going to heal or some kind of helping to relieve the pain on the eye, like that. And energy healing. So what they believe is in the ancient time, the Far Eastern people, Far East Asian people, they believe there is some kind of energy is going inside your body. If you can control that energy by yourself, that means your own energy, then there will be no disease. If the energy is trying to control yourself, then there's a chaotic and problem. Okay, but there is not enough evidence to support this theory. But still, in Japanese and Chinese few films which take you for the traditional China and Japan, you may see that. So there are one thing called Reiki. So what they do is they keep the hand above your body. They don't touch you like this. And they believe there's a kind of energy transmission, and the person or the patient will feel a kind of relax or healing. And therapeutic touch, what you do is you move the hand over this energetic field and lightly touch, like here and here. Then other thing is alternative medical system like Ayurvedic medicine. This Ayurvedic medicine is system from India. We are so close to India and still some people are practicing Ayurvedic medicine. And like you all, there are Ayurvedic doctors pass out from our government system every year. The goal is of the goal of Ayurvedic medicine is to clean the body and restore balance to the body, mind and spirit. Your body, your mind and the spirit. It uses diet, herbal medicine, exercise, meditation, breathing, physical therapy and other methods. These are few Ayurvedic treatment remedies. And we have a famous Ayurvedic hospital in Barolla, Colombo. And there are Ayurvedic medical students wearing coats and going to the hospital to get practice, like you all are going to the Western hospital. And traditional Chinese medicine. So, this again a wonderful theory. They say there are a lot of channels going through your body, like top to bottom. They say chi, the chi, the body's vital energy. So it's between the two forces, yin and yang. So it keeps the body in a good spiritual, emotional, and mental and physical health, or in a balanced manner. So this key you have to maintain. Then the acupuncture, you all know there are certain points in your body. When you prick with the acupuncture specified needles, then your pain will heal. And even a lot of Western doctors, MBBS doctors, practicing that to reduce severe chronic pain. So this is your key, and this is how it works. It will take a lot of time to explain that, but you know there are things called key that control the energy via energy channels in the body. It has all the 5 elements of the world: earth, fire, water, wood, metal, air. And these are acupuncture marks, and this is how you put this. And naturopathic medicine, it's a system that avoids drugs and surgery. They only use the natural agents such as air, water, light, heat, and massage to help. But it's still debatable and no evidence-based research or findings available. Homeopathy, it's again a treatment. My great grandfather he's from India, he used to treat, he used to do that, homeopathic practice. Okay? Then the safety of, because when I am telling you the CAM, the complementary and alternative medicine, when you are listening, it is very interesting. Like, ah, there's a key going inside our body. There's an energy field. But why are practicing this? Oh, when you are practice this or prescribing this, is this safe for the patient? Some CAM therapies, of course, the evaluation and examinations done, and they generally safe and effective, but most of them we don't consider it as safe. But acupuncture, yoga and meditation, we believe they are safe. And natural, you are having all the natural things in the environment, it doesn't mean it is safe to you, because I said these natural things can have interaction with your Western medicine, so that can affect you. Like, or without interaction with your Western medicine, that can affect you. Like there are things called kava in large doses, This herb usually used to treat stress and anxiety, but in large doses it can cause liver damage, like St. John's. Okay. So if you are a patient, if you are taking any dietary supplement, vitamins or whatever thing, no matter how safe you think they are, you have to tell that to your doctor, because he's going to prescribe you conventional medicine. You are taking CAM, complementary and alternative medicine. So you should tell him what you are on. So what about the present situation of herbal products? That means Ayurvedic products, a kind of supplemental industry in Sri Lanka. They are not coming under the scrutiny of National Medicine Regulatory Authority. Like you remember during the COVID, one person without any recognition or any authority came and sell what penny? There's a some penny for the COVID, right? I don't remember the name, but you may, yeah, that's a one kind of penny, right? You remember even the people in the parliament also, there was something say they drink and something. So some penny, I don't remember the Buddhika penny, or I don't remember, some kind of penny for the COVID they drink. But it's not coming under any authority. If you are going to distribute or sell that to the society or the community, what you have to do? You have to get the recommendation letter from the Department of Ayurveda to manufacture herbal medicinal products in Sri Lanka. Then you get ITI certification, ISO and 5S certification. And when you are manufacturing, you have to maintain good manufacturing practices to maintain the purity of that herbal. Otherwise, if any infectious agent goes inside that, it will cause problem to the consumer. So like that, there are a lot of things. Even when we are going in the bus also in a long distance journey, some people come and say, this is what we are using. We are practicing this for 50 years, 100 years. So some are coming with a label, some are not with a label. So we don't know the authority of that and authenticity of that particular herbal product. So that is a serious issue in our country, present problem. Okay. Now that's overall idea about the complementary and alternative medicine, and as a homework for you all. Explain the differences between a Western drug and an Ayurveda drug with regard to efficacy, safety, and quality. I think the general pharmacology you have covered what is efficacy, what is safety, and what is quality. So you can work that out, and these are the references. If you have any question, you can contact me via WhatsApp or email. I hope this just one of the basic lecture. So hope you understood everything. And I always say, may peace be upon you. And thank you very much. Have a nice day.